My name is Sunny O'Malley, and I am the coordinator of the 5th Annual Low-Dose Naltrexone Conference. My job is to, once again, have a group of extraordinary presenters come to, in this case, it's Bethesda, Maryland, and the National Institutes of Health, and make a presentation about low-dose naltrexone and really educate people as to how this wonder drug is changing lives and working small miracles for people who have a range of illnesses, from cancer, autoimmune disease, multiple sclerosis. We have presenting the wonderful, outstanding Dr. Bert Berkson. He is a practitioner, a medical practitioner, a licensed physician from Las Cruces, New Mexico, and he is going to be talking about his use of LDN and alpha lipoic acid for his patients. One who is 7 years past diagnosis for pancreatic cancer. Very much alive, doing extraordinary things, enjoying his life. Have Dr. Skip Lenz, a pharmacist who owns Skip's Pharmacy in Boca Raton, Florida, who is one of our platinum sponsors and always a good friend to the LDN community. He will be speaking from his perspective in the pharmacy world of what LDN has been doing for patients and the many, many prescriptions that come to him that he can literally see the difference in people's lives. And then we have the marvelous, always fun, extraordinary lady Mary Boyle Bradley, who is the author of Up a Creek with a Paddle and also the host of her own talk radio show on Blog Talk. Every Tuesday at 1 p.m., Mary talks with various people in the LDN community in an effort to educate everyone about this incredible find. One of the goals of this conference is to raise money for clinical trials. I have designated Dr. Jacqueline McCandless's HIV AIDS omalley study as the recipient. I understand that this study is ongoing and that she is very nearing her goal financially to be able to complete it. So I'm certainly hoping that anybody who is at the conference will make a donation to the Ojai Africa Fund, Ojai Foundation Africa Fund, and support her as much as possible. You can do this online. Last year I was very much leaning towards starting my own foundation, and I did, in the name of my father, who was so helped by LDN. It's called the Emory James Sedlock Foundation. It is still in its baby stages. It has been work in progress, as this is something I do on my volunteer time, not as my full-time position, and I am still putting the finishing touches on getting it approved for charitable tax deduction donations. But I put it together for the purpose of having something here in the United States as a main fund where people who would like to contribute and see money raised for clinical trials of LDN could do so through the One Foundation. Part of it is that this has been a very fascinating year here in the United States in terms of the healthcare debate that goes on and on and on. And it is very frustrating for me as a person to know that when it seems that the cost of healthcare, rising costs of healthcare, are such a concern, that our leaders, frankly our leaders on both sides of the aisle, really don't want to listen or hear much about LDN. This is truly a people's movement. And once again, I feel that we the people must step forward. We must step forward in our country, because what we have is not an alternative therapy, but a mainstream therapy. It must become recognized as such. And it is an inexpensive generic drug that is compounded and very easily affordable by just about anyone in any part of the economic life that we live. And certainly, if someone did need assistance, it wouldn't cost the kind of outrageous billions of dollars that we're talking about. So it's a drug that its time has come. It never before has it been more obvious to me that we the people have to stand up and speak loudly. Our voices must be heard. we cannot allow a system or a government or anyone else to ignore something that is so powerful and so obviously for the benefit of one and all. The start of International LDN Awareness Week. This is the second LDN conference this year because there was a European conference in Scotland back in April, and here we are in October. We are in the nation's capital in Washington, D.C. at the National Institutes of Health, and there's never been a time that it was more important to talk about LDN and really make certain that this is not a secret. This must be known. Write your congressman. I wrote to mine. Naltrexone was FDA approved at the 50 milligram dosage level in 1984 for narcotics addiction. Totally different matter. Downgraded, compounded down to the 3.0 level or 4.5 milligram level. It works for these other things. And it's a wonderful, wonderful treatment with virtually no side effects, and it almost sounds too good to be true. When people hear about this, they say, oh no, if it had been, I'd have known about it. It's because it's just too easy. You take this little compounded pill between 9 p.m. and 3 a.m. every night, and that's it. How can you possibly be curing, or I wouldn't even say cure, but holding at bay a dread disease? It's mind-boggling, and that's why we have to have these clinical trials, and we have to go through raising the money and all the rigors that are required so that the medical community and the patients, the physicians and advocates, wise up. I respect your right to do what you have done, but I'm not going to prescribe it. Well, that's a real shame. I think the day will come when the funny part will be they will be sued for not prescribing it.
When your father was taking LDN and he had multiple myeloma and he went into remission, what did his doctor say?
Well, his doctor was Dr. Bernard Bahari, so his doctor expected that completely. His oncologist stopped talking to him when he went to Dr. Bahari. Literally. The oncologist never contacted us back. We canceled an appointment because we didn't want to go any further with what he had recommended. And he was going with low-dose naltrexone, and we never even as much as got a phone call or a letter or anything. His other doctor that we worked with said, at your age, I'll go along with it. Mind you, this is the same doctor who wouldn't write it for me, but who would write it for my father, because my father was up in years, 89, 90 years old. Might as well. When my father passed away, as you know, Cindy, it was respiratory failure and not multiple myeloma. He put that cancer into remission. And I will tell you, when every nurse that saw him, every other doctor that might have met him along the way said, that man does not have multiple myeloma. He can't. You can't look like that and have multiple myeloma. And that's true. And I'm forever grateful. Nobody can live forever, but it's a quality of life. It's not just quantity, it's quality. And I can only feel that he would have died a lot sooner had it not been for LDN. Because he wouldn't take the chemotherapy and radiation. I thank God he wouldn't. I think that might have very well done him in as well. I'm excited about this conference. I'm very happy that we will be here at the National Institutes of Health. I think it's just the beginning, and I think it's just imperative, and I call upon everybody who watches this to tell someone about LDN. Research it yourself and tell someone. Tell your congressman, tell your council people, tell your neighbors, tell your friends. This is something that is for real, and the only way it will be out there as an alternative, especially when we're talking about changing our entire healthcare system here in America, is that there is a viable alternative that is not going to cost that much. It is affordable, and it may very well save your life.